session is now being recorded, and we welcome you to the July meeting for the statewide CDSMP collaborative group. And we'll start with going around and seeing who is all on the call. So I have a list in front of me. I will introduce myself. Again, this is Mary Pat Gallus. I'm with COA, and I am chairing the collaboration. And we have with us today Cheryl Wakefield once again, who's dutifully doing the minutes. Thank you so much. And then also we have Kelly Jackson, who's with us. And Kelly is a program coordinator here at COA and is sitting in for the first time. So welcome, Kelly.
Thank you.
So it looks like we have a couple folks from Clinica Tepeyac. Would you like to introduce yourself?
Yeah, my name is Teresa Rowe, and I am from the Health Promotion team.
And my name is Maria Lopez, and I am the Director of Health Promotions.
All right, welcome, Teresa and Maria.
Thank you.
Kelly?
Yep, and this is Kelly McCracken, and I'm with CDPHE and am involved in the CDSMP collaborative as we collect the data for this project.
All right, thanks, Kelly. And then Ellen, it looks like you've joined us. Ellen Hillstrom. She's showing online. She might be only a call-in. I'm not sure. But we're showing her also attending the meeting. And Ellen is from the University of Colorado Health up in Loveland, Fort Collins, in Loveland area. She is not yet connected with the voice, but she'll call in. She said so. Welcome, Ellen. All right. So here is our agenda for today. We will have Kelly McCracken share with us a little bit of update on anything with the data entry, and also specifically talking about the epidemiologist visiting one of our meetings. A brief update from our grant year and how things are going. I will mention that Connie Young is not able to make the call today, and so we don't have a lot of agenda items since she was not able to attend. Item 4, I'll give you an update what's happening with Telegen. Meredith Koob also is going to miss the call today, but she did give me a written email, so I'll share that in a bit. And then one of the items we've kind of had rolling over month to month is HIPAA compliance issues. So maybe we'll have some time today to share a little bit about that and how people are handling meeting compliance. And then, of course, we'll look at our statewide training updates and discuss any future agenda items. Does anyone have any items they'd like for us to share today or talk about? Because I think we'll have time. Well, if not, we'll just move on then. Oops. So we did our introductions, and you know about our website. I always like to remind folks that www.selfmanagementcolorado.org is our collaborative website. Hopefully you are all having opportunity here and there to get on there and check out classes that are happening, not only user classes throughout our state, but also leader training. So it's an excellent location, and it's a great place to send some of your partners and providers and so forth. So I'm going to give a plug for it today. All right, so let's move on to Kelly McCracken, and if you want to share some of your information, Kelly, or questions you might have for us.
Sure, and you know, there's really not too much to share in terms of any data collection. I mean, we always want to just have a space on this call in case anybody's having any questions or concerns about how data is collected and entered into the NCOA database. So I just want to give some space for that if anyone on the call has questions or concerns about data collection.
I had more of yeah, I do have a question. This is Maria Lopez. Hi, Kelly. How are you?
Hi, Maria.
I wanted to give a shout out on, since it's being recorded, I wasn't able to be on last month's call, but I heard Kelly on NPR, and I felt famous just by knowing her and hearing her talk.
Oh, Lord.
So I wanted to say that first. It was a great interview, Kelly.
Well, thank you. Yeah, that was for the new Medicaid coverage for diabetes self-management education that started July 1st. So thanks, Maria.
Yeah, that was cool. I felt famous. Anyway, so question I had, how do, and I know I've asked this, I just think I didn't document it well. How do I access or make a request to get data of what we've been doing from the system? How does that work?
Yeah, that's a great question. So you can send, so Clinica Tepeyac, you've been sending your data directly to Lori Scott, is that correct?
Yes.
Okay, so you can reach out directly to Lori. If you want to CC me, that's fine. If you don't, that's fine as well. Lori's very responsive, and just let her know what you need. Understanding that the NCOA database is somewhat limited in the reports it can create, but it can create a report that's specific to the licensing organization, and we tried to make all those corrections in order for that to be a valid report. You know, maybe like well, it's probably only like 3 or 4 months ago we kind of did all that. So yeah, just ask Lori for that, and then if Lori has any questions, she'll always wrap around with me too. So.
And what is the time frame I could expect, like the request? Because you know, I'm not very familiar about what we submit or how the reports can be run. So I just kind of want to have a good idea of, you know, what we're doing and kind of what our outcomes look like, and how, you know, kind of those things. So it's just a really basic, you know, I want to see what we're doing, and you know, maybe see that over the last 3 years if we have that, or what that time frame be. So would that be how I would pose that question? Or?
Yep, I think you can just ask her, and she'll work through that with you. She can tell you the limitations of the database and how far back it can report, and all of that. She'll share that with you, and then you guys can work together to get the report that you want. You know, usually her turnaround time is in a day or two. I mean, she's pretty quick.
Wow.
So.
Great. Awesome. Okay, thank you.
Yeah, no problem. And I'm not sure there are any other license holders on the call today, but are there any other questions regarding data? So the other thing that I wanted to just bring up was a conversation that got started maybe the last CDSMP collaborative call or the one before, in regards to high burden areas in the state for diabetes and well, it's really diabetes in particular is what we were talking about, but we have data that also relates to cardiovascular disease, and as Connie Young was talking about, we have some modeling that looks at multiple chronic conditions and where those burdens are as well. That would include things like cancer. So you know, my question to the group was, would it be valuable to have, see if we can schedule time with our state epidemiologist for chronic disease, Renee Callanan, to be on the call to talk a little more about that data and to answer questions. You know, as you all are planning your programs and classes, I mean, I know you can't control where your locations are in particular because you obviously have your buildings in certain counties, but it could be interesting just to sort of talk through where those high burden areas are as a collaborative to think about where we may want to target future license holders or classes in the state that could support some of the burden that's in those areas. So that I just wanted to ask if anybody was interested in me trying to arrange her on a future call.
Well, you know I am.
Yeah.
I think that'd be great, because also not just about programming, you know, it could speak to collaboration.
Totally.
Yeah, for sure. COA, we would be very interested in having an opportunity to do some Q&A with her, because maybe we're looking at information and data. Sometimes I don't always know what it means or how to read it.
Yeah. Yeah, I hear you.
I think that would be really helpful.
I've been at the state now 3 years, and I still, I mean, you know, it's a bear. I mean, you know, and to really kind of understand how you translate that data to action, and yeah. So okay, cool. Well, what are, I don't even know what I mean, would it be sort of any of our meetings that she might, you know, because I can then check with her schedule, or are there specific meetings, Mary Pat, that you think would be more open to her to having availability on the agenda?
I really think, Kelly, at this point on, any one of our meetings coming up, even August, September, whatever her schedule works, or the first Thursday of the month for now. And I think our agenda items are going to sort of decrease because it wraps up the end of next month.
Yeah,
at the
right.
end of August.
I'm still waiting to see what the next.
Yeah, and then maybe, but even if the next one comes through, there's a little bit of a lag time before we, really begin to initiate any action on that next grant, let's say. That I think that's a great time, in my mind. And plus, we can always have a guest speaker for 30 minutes, 20 minutes, whatever she needs.
Yeah, and our meetings are now the first Thursday of the month?
Correct. 9 to 10.
Okay, so we're not going back and forth Thursday,
no, we're
Friday.
Not.
Okay.
We're not, at least not until the end of the year, and then we may do another Survey Monkey to see if people want to change the date and time, but this was the one decided on for 2015.
Okay, very good. All right, so I'll reach out to Renee and ask that. She just recently had a death in her family, so I'm not sure when she'll be coming back from bereavement, but I'll get with her later this month, and probably August won't be, maybe not, but I'm thinking it'll probably be more like September or October. So.
Okay. Kelly, what is her full name so we can just put it in our minutes?
Sure, it's Renee, and it's spelled R-E-N-E-E, and her last name is Callanan, and it's C-A-L-A-N-A-N.
Callanan.
Can you repeat me again?
I'm sorry?
Can you repeat the name? Spell the name for me, please.
Oh, sure. It's Renee, R-E-N-E-E, and her last name is Callanan, and it's C-A-L-A-N-A-N.
N-A-N.
Is it one A or two A's? C-A-L-A-N-A-N?
Yeah, C-A-L-A-N-A-N. Yeah, I was just repeating that A again.
No, that's okay. Want to be sure we got it right.
C-A-L-A-N-A-N. Yeah, I just looked it up just to double check.
And her title is epidemiologist.
Yeah, she's our chronic disease epidemiologist, and she actually is an employee of CDC. She's in the Public Health Service Corps. She's a commander in that corps, and but she's placed here in Colorado. She's really fantastic and smart woman, and so it'd be good. It'd be a good conversation.
Yeah, it sounds like it. Okay.
So that's all I have, unless anybody has any questions for me.
Any other questions, anyone? I also want to recognize that Monica Wolf has joined the call. I don't think she has audio right now, but she did let us know she's on the call.
Okay. And maybe once I guess I'm just going to add one more thing. Maybe once I kind of nail down with Renee a good date, Mary Pat, I might connect with you, or I might put out just a short survey to the collaborative just to kind of get an idea of what a good topic. I mean, we've talked about burden maps, and we've talked about, you know what I mean, but just to sort of nail down that specific interest. So I'll get with you on that.
Okay, and then we can always pass that on for sure, like we've done.
Okay.
And thank you again, Kelly, for the last state plan on chronic disease.
Oh, no problem.
Packet you sent us, that was great information for all of us to have.
Thank you, no problem.
Okay. All right, so I am going to click on to the next slide. This is another standing agenda item, is an update on our current grant, which we are in year 3. Connie did not have any updates for us. I think she's had a really busy last few weeks, but so there's no report on our sustainability plan at this point, and I believe on the carryover funding, I think it's pretty much in progress, unless anyone had any specific questions. I know Lindsay Blackwelder has reached out to those of you as license holders in gathering up and setting up additional reimbursement options that you may have each independently as license holders. So unless there's any other questions or concerns, they didn't have any other updates regarding that factor, carryover funding. We all know the last date is August 31st. Some of you, I'm sure, are well done by now, meeting your reimbursements and so forth. And then the carryover funding was retroactive, so that probably really sped things along quite easily for folks instead of starting up new classes at this point. So, and as Kelly mentioned, another grant has been submitted. It's a 2-year grant that Connie has submitted, and we haven't heard anything on that yet. I'm sure if Connie hears something, she'll let us know, but it's just kind of it's in submission, waiting to hear how it's accepted. So looking forward to and hopeful that that will also happen for us. Any questions there? All right, so Meredith Koob, and many of you know her, she is working with Telegen, and she has been working on, along the same lines, actually what Kelly just mentioned as well, about the reimbursement situation for diabetes self-management program. And so I'm actually going to just read her paragraph here that she sent in an email as a update. So these are her words. Telegen is in the final phase of determining if there is an opportunity to provide a bit of reimbursement to organizations that are willing to partner for DSMP or Manejo classes. Once this is determined, Meredith will forward a recorded PowerPoint for collaborative members to view that explains Telegen's diabetes education initiative, as well as a short survey monkey to indicate level of interest to meet individually for further discussion on partnership opportunities. This is most heavily focused in areas of Colorado that don't currently have access to diabetes education. And in parentheses, she notes that means that particular area of Colorado may not have DPP, it doesn't have DSMP, or it doesn't have clinically based diabetes education programs. So just keep that in mind, that the target areas are going to be those gaps in service throughout our state. But nonetheless, she would love to hear from you all once she sends out this little PowerPoint and SurveyMonkey, who might be interested in partnering with them on potential reimbursement for doing the diabetes curriculum, and also obviously the diabetes curriculum in Spanish. So any questions? Anybody want Meredith to follow up with them? Excuse me. Is that clear as mud? Could be a good opportunity, it looks like. All righty. I'm clicking so fast. All right, so I added to the agenda this item that's been on our to-do list, so to speak, for a while, the HIPAA compliance issues. And I believe it was Melissa Pruitt who initially mentioned this request, and I'm sorry she's not on the call. And so I don't know how much discussion we'll be able to have. But what I think we wanted to just sort of brainstorm here and talk about what different practices are doing is how you're handling like the information, your participant survey information, maybe how it's being transported. How are you know, who's got eyes on that information? How are the leaders handling it? Any best practices out there that people would like to share on how they're doing that, or suggestions, or maybe even concerns or questions you might have? Don't be shy. No? Well, is anybody out there?
We're here.
Okay. Is it just me?
So,
So,
you know what would be helpful for me?
How do you guys handle your participant information, which would be, you know, the piece that we're probably most concerned about right now?
Well, you know, we definitely follow. We're very HIPAA compliant. We're at a clinic, so, you know, we do lock it away. We, you know, our promotoras take it. So, you know, I think what would be a bit more helpful would be, you know, just almost like a best practice, like what you recommend. And, you know, I think there might be different procedures for those community-based organizations, and then there's different ones for the clinic. But, I mean, you know, we're pretty strict on how we handle our patient information and who has access to it and who can see it. So, but for me, it would be helpful just to have that, so then I know when I'm passing that down to my staff that, you know, hey, we have a checklist of everything we that we're doing and making sure that we're doing the best that we can.
Okay. So maybe a suggestion is on a future agenda to maybe start with some kind of a outline, or develop a checklist type of a thing to see that, and maybe start with that, let people add and edit and so forth, and see if we can come up with something that might be useful for everybody. Is that what I'm hearing?
I think that would be great, because then, you know, it'd be, you know, it's not something that we would have to do, but it's just saying, hey, here's the best practice, and, you know, and then it gives people a good kind of overview of here's what you got to do.
Okay. I would imagine those of you who are doing trainings, too, leader trainings, that some of this issue is discussed right from the get-go at the beginning of the leader training, because we have the whole non-disclosure form that has to be signed, and that really starts that discussion of covering the Privacy Act and how we handle information and so forth. So I think we could maybe develop some kind of an outline checklist that even starts at that point. You know, what have they signed the non-disclosure? Do they understand it? Have they seen the webinar, etc.? And work it all the way through to when the class information is finally completed and submitted back to the license holder. Does that sound like a good idea?
Again, I say yes.
Okay. I think
I'm trying not to talk. I was trying to just be quiet.
Well, you know what? We've already had a couple folks who've. I know Kelly McCracken was only going to be on for a short while, and she's off the call now. And Ellen is on the call, but and Monica's back on. So that's another license.
Okay.
Ellen is a license holder. Ellen, can you hear us? Or? Yes. Okay. So I didn't know if you guys have any practice to share. I don't know that you've got audio. It doesn't look like it. Okay. You are only seeing the initial slide. What does this say? That maybe is the problem. Somebody, a couple of you can't see slides. We are having problems with the getting into GoToMeeting this morning and trying that phone number. I see that some of you are having some issues with that. Okay. I apologize. You may have to hang up and retry. I think some of you tried that. And then if you go to that main website page and it gives you the information, there's a little line that says, if you're having difficulty connecting, click here, and it will give you an alternate phone number. That's what I had to do this morning. So we seem to be having technical difficulties today. All right, well, it sounds like on the HIPAA compliance, we'll move ahead on developing and putting it into the agenda so that everyone has something to maybe look at and start with and have some discussion around that. All right. So really the only other slide I have is our statewide training updates. And again, all this information shows up on our Self-Management Colorado website. And I did look at those yesterday, and they should all be up to date and current. If you are going to be hosting any kind of training, be sure and get it to us here at COA, and we'll get it posted on the website. This is just obviously within our minutes, and you can see what's coming up. We're doing a chronic disease in Colorado Springs. We have the pain cross-training on the pain self-management program that's coming up in August. We'll be doing a 4-day cancer thriving and surviving training in September. And then CU Health has a chronic disease offered in September as well, a 4-day training. And that's followed by another day of diabetes. If someone is interested in doing the full 5 days, they can actually cross-train in diabetes as well. And that's being held in Loveland. So once again, we have these and then that 5th day diabetes training. And that's all we have currently on our website. So if there's anything else, don't hesitate to let us know. I do think Melissa Pruitt in Boulder is going to be doing a 4-day diabetes leader training in the fall, but I don't have any specifics on her. She mentioned it to me, but didn't pin down the dates and location, I don't think, quite yet. But I know she's looking to do something like that. And other than that, I think just asking again for other agenda items, ideas that folks might have on things we want to cover as part of this collaborative. I think it's really important for us to be thinking about what the collaborative purpose and service will be as we move ahead. In particular, if we shouldn't get the next grant, what would be some of the items and topics you would like to see us cover as a collaborative? You know, I wrote down a few myself. I was looking at kind of along the lines of what Maria's talking about, best practices on referrals, maybe having some agenda item along those lines that we could talk about people's successes in getting clinical referrals set up. Looking at funding support, these were discussions we've had. We had a lot of good discussion on that in our sustainability retreat, and so that could be certainly future discussion topics is what are some funding options, how do we find funding support that's sustainable outside of these grants. I'd be interested in talking about cost for classes, what people are charging, are they charging, are they looking at charging, success with fees or not, you know, just all the options there along cost for classes. I think there are some of the organizations that are not allowed to charge a cost. So it would just be good discussion perhaps to look at what some of the options are. Maybe they have some other creative funding ways that would help us all, just part of this network and collaboration. Another future topic was some discussion that's occurred about, do we want to look at this collaborative adding falls prevention programs and making it all evidence-based programs in collaboration, and maybe those topics then alternate, you know, that we sometimes are addressing the chronic disease programs and sometimes we're addressing falls programs and that sort of thing. So I think that's something that could be talked about and perhaps a future role for the collaborative. And then last but not least, one of my future agenda items certainly will be who would like to chair the collaborative next. I know COA has done it for these first 3 years. We're committed to the end of 2015, but certainly want folks to begin thinking about other leaders in our state taking on that role as chairing this collaborative, and also the minutes, doing the minutes and getting them posted. We can help with the posting them on the website since we have access to that, but sure would welcome other suggestions in that area too.
So I have a quick question about the agenda items. Did you want us to throw some out there, or are you asking that at the next meeting we kind of talk about it?
No, you can definitely throw some out right now. That's what this time is for.
Okay, so what I was thinking is if Kelly is going to be presenting data around disease burden and kind of where that's at for this state and with chronic disease, I think it'd be really interesting for us to kind of not really make a strategic plan, but utilize whatever's out there and kind of figure out what we're seeing. I also would like to know with the data, because it's going to be very chronic disease focused, I would like to kind of know what our accomplishments were and what our challenges were, and maybe build off of that, like build off of some future focuses of what's really worked for us. And, you know, with the new funding that's coming, how do we use that to support what's already been built and kind of still address the funders' wants and needs? Because oftentimes I find in programming, you know, the funder comes out and they want to do a new thing, and you're just getting started doing, you know, something that's really working. And I kind of want to, and this is selfish for me, so I kind of want to say that up front, but it'll really help me learn from the valuable content experts out there and what you guys have been doing and what's been working. So I would really like to hear that. And as far and so that's kind of what I was thinking, build off of that data stuff, if we could,
Right.
to kind of figure out programming and collaborations and things like that, and focuses of the new grant. And then as far as chairing, is there anything, I'm not sure if you guys have bylaws or anything like that, but would there be anything like keeping you all from doing that again? Or, and it's not that I wouldn't take a leadership role, but I just do think that you guys have done, and I've been here a short time, but you guys do a really excellent job with these meetings.
Well, thank you. And I've only done it this year. Lindsay really had picked up the first 2 years. And I think it's mainly just wanting to share the opportunity to have a leadership role in the collaborative and have more representation perhaps throughout the collaborative in that role. And so we certainly want to put that out there, and then and you know, we've got a few months to be looking at that and considering that. You know, whether COA could take it on for another year would have to be some internal discussion that we have in our staff. We have some different grants and stuff coming through that may stretch us a little thin.
What is the time commitment?
Well, let's see. So you chair this meeting once a month, live recording time, which so you figure 9 to 10:30, maybe with a little bit of prep time as you prepare the slides.
Develop the agenda and coordinate speakers.
The agenda, and then you know, respond to folks who have agenda items that want to get added, etc. Add into the slides. So there's a little bit of prep time as you get ready, you know, and then doing those periodic collaborative emails. As Kelly was mentioning earlier, if there's information that somebody wants to share, then it usually comes through us, since we've developed a group list, and then it's, you know, which isn't too cumbersome to do. I'm going to try to think other roles that COA has done, which don't really tie directly to the to being the chairperson, is the minutes, and that's taking minutes, as Cheryl is doing for us right now, and then, you know, so doing that during the time of the meeting, then following up, editing them, getting them out, and we got to post those on the website. And so there's that. That takes some time, certainly. That could be a separate role, and would welcome that to be a separate role. Then we also manage the website, so as people submit classes, trainings, all that kind of stuff, we take that information here at COA and put that into the website, our collaborative website, which we could maintain that role. So that's what I'm saying, you know, there's other pieces and parts that we would be happy to continue doing. I think
that's helpful, because the website, that sounds scary to me.
Well, that's Cheryl. She's sitting here next to me. She really does a lot of that legwork.
Kudos to Cheryl, because the website, people try to keep me away from it, in fact.
She does a great job, really great job. So those are things that maybe at this point it looks like COA has, that this role / COA has a lot of responsibilities, but we can divide those out. And I think carrying the collaborative could be one that could be divided out.
Okay.
And we could assume some of the other ones that have to do with the website, certainly, but allow others to have an opportunity to serve in this role, in a leadership role.
Yeah, that's great. That's a great opportunity. What I was wondering is, would that be something we could send out in the email to see kind of who's kind of interested and go from there? Because I would definitely like to kind of see who's out there and see who's interested.
Right.
And since it's a small call,
interested parties, kind of sort of interested, but with, you know, wanted to get a little more acquainted with the collaborative and, you know, participate for another year or so forth. Yeah, so we're not done talking about it, that's for sure.
Great. Okay, great. Yeah. Well, and
But
just thank you
wrote down
guys
your
for what you're.
suggestions
Yeah.
about maybe the collaborative developing a little more of a strategic plan based on some of the data information that gets shared with us, and then your ideas about sharing what has worked, what are some of our challenges as we have delivered this program. Yeah, those are all great topics.
Yeah, and I'm happy to help with the strategic planning. I actually love doing that kind of stuff. So if you guys, you know, if we need to work on that, or that's extra capacity, or I don't know how that works with the funding, or who might do that, but I'm happy to participate, and because that I think will really help me learn as well.
Good. All right. All right, so I think other than we have our next meeting is scheduled for Thursday, August 6th, 9 to 10:30. I'd also, yes, I see a note from Ellen. She would like to talk a little bit about anybody else who might be serving in the Colorado Springs area. I believe, Ellen, that is your question. And as the collaborative, if there's anybody else on the call who has done any work, as you all know, Ellen, she doesn't have audio access, I don't think, right now. So anyway, she has been working with University of Colorado, and they also, when they assumed Poudre Valley Hospital in Fort Collins, they also brought under their wing Memorial Hospital down in Colorado Springs, which is now a CU Health system. So I believe she's looking at doing some classes maybe down there, or referring folks that they're working with down there to classes. So Ellen and I had shared a little bit with her about the work we're doing in Colorado Springs. We have been down there for several years, and we've got leaders trained down there, as well as you probably noted that we're doing a training this month in Colorado Springs for new leaders. But in addition to what COA might be doing, we've been working with a lot of the clinics in developing referral systems. We actually have 2 classes starting this month in Colorado Springs. One's with the University of Colorado Springs campus. The school has a health center that services older adults, and so we have been connected with them and doing some classes there, UCCS, the Lane Center. And then also we're doing a class with Doctors Medical, which is a private kind of standalone clinic down there, working with Mountain View, which is another clinic system in Colorado Springs, has about 6-7 clinics. They've done a lot of classes with them in the last couple years. And then Age Well, another practice down in Colorado Springs. So we've done a lot of classes in Colorado Springs ourselves, as well as, like I said, we have leaders and they're co-trained in diabetes and cancer. We have 3 of them coming up for the pain cross training in August, so that we can offer a variety of curriculums in the Colorado Springs area. But anybody else? Who might be of interest, Alan, is I'm thinking Crystal Ryder from Secahek, which is in Pueblo, and I don't know if they're doing any other classes into El Paso County or what. So she might be a person to make one-on-one contact with. She's not on the call this morning. As I'm looking at who's on the call, okay, doesn't look like anybody else on the call might be, other than Monica Wolf, maybe down in the San Luis Valley area, if she goes up into Colorado Springs at all. She doesn't have any audio as well. So note to self, July may not be a good time to have a meeting.
It's always rough. It's rough.
It is. As I was hearing back from folks in preparation for this meeting, you know, we had a lot of people who are going to be out of town and on vacation, etc. And I just thought, this might be the month to skip. And then I don't know why we're having technical difficulties today with our go-to meeting, but apologize for that again. So Ellen, I don't know if you're going to get much information other than what I've shared, but I will suggest that you do talk, if you need to, more directly with Crystal Ryder in Pueblo, and maybe even Monica Wolf down in Alamosa. They're based out of Alamosa, but I don't know if she's reaching into that area at all with classes. We did do some, we did the pilot project for the Cancer Thriving and Surviving with Memorial Hospital and their cancer center, and they were very, very involved, did a lot of referrals into the classes down there. I want to say we probably hosted about 4 to 5 classes at the hospital. I actually did fidelities on a few of those. So they were great partners. I think the individuals themselves, the point of contacts, are gone now. They've moved on into some other jobs, but they sure were receptive, especially for the Cancer Thriving and Surviving. So I'm not sure what your intentions will be, Ellen, but got some information for you. We're doing so much of this. Monica says she is not doing anything in Colorado Springs, but she's looking at a class in Walsenburg. Oh, okay, and Ellen has responded that she did have contact with Secahec, and so she's covered that base. And Monica said she'd be happy to work with you, Ellen. This is so funny. You both are sending chat, and I have to read the chat to you as a middleman. So I really do apologize on our challenges today. But Monica's happy to talk with you, Ellen. If you want me to send you her email address and number, I'm happy to do that. It sounds like you made contact with Secahec, so that's great. All right. Next meeting, Thursday, August 6th. And unless anyone else has anything else, we will close out our meeting for today. Any final comments?
Thank you.
Thank you.
You are welcome. Everybody stay dry. Stay cool. We will see you guys again in August.
Okay.
Take care.
Bye.
Bye-bye.